Sisters United Outreach Ministry is proud to present Let's Talk Family, a woman, men, and family-centered TV ministry. This ministry addresses the whole person mentally, emotionally, physically, and spiritually throughout educational development, interpersonal relationships, and provide community resources.
Welcome to another segment of Let's Talk Family. I'm Sister Ann Allen.
I'm Sister Tina Edie.
And I'm Sister Laura Davis.
And I'm Bob Sisler.
We are so blessed that you have chosen this opportunity to tune into our broadcast. We hope you'll benefit from what we might say. We want to appreciate your comments. Our telephone number is 313-615-6323. Again, that number is 313-615-6323. You know, as always, before we begin our program, we always like to give attributes, give God the glory, because it's in Him that we live and move and have our very being. At this time, we're going to go to God in prayer. Our Sister Good is not here today, but we ask you to continue to pray for her, and we pray for all the bereaved out there. So let us go to God in prayer. Dear Heavenly Father, once again, we approach your mighty throne of grace. It's in you that we live, we move, and we have our very being. We ask you to bless those out there in television land. We ask you to bless those all in the internet land as well. We ask you to bless us, Lord, as we continue to strive to do those things that's perfecting toward you. Lord, we ask you forgiveness for our sin, and we thank you so much for your darling Son, Jesus Christ. And we pray, Lord, that we say something that to inspire and encourage someone else to continue to hold on to your unchanging hand. In this prayer we ask, dear Lord, in Jesus' name, amen.
Amen. That was good.
May we also remember Nelson Mandela as he goes through this stages, and that God's gentle touch be with him no matter what happens.
That's right.
Yes.
And we do want to pray for the Mandela family.
Amen.
And thank you so much for reminding me. That's why all of us is a unit.
Amen.
Where one person might forget the other person.
Yes.
I forgot it the other day.
God
Somebody had
bless
to
you.
remind me.
Yeah,
Okay,
that's
good deal.
fine. So at
It's
this
been on
time,
my
I'm going
mind
to
every
ask
day.
Sister Edie if she would give us some words from our sponsors.
Our commercial.
Good evening. Welcome. And now here's important information that will put you in touch with more data about our program. We have, number one, Ronald Cross is the ministry of Metro Central Church, who reaches out to the world of message of faith, located at 4455 Barham Street in Detroit, Michigan. Wednesday night service at 7 o'clock p.m., Bible class at 9:45 a.m., and Sunday held at 11 o'clock p.m. This number, you can contact that church at 313-640-9970. Our next church we have is Church of Christ on Linwood at 14001 Linwood in Detroit, Michigan, with Minister Donnell Stewart. Come and visit us at Linwood Church and be blessed. And their services are held on Wednesday night service at 7 o'clock p.m., Sunday early service held at 10:30 a.m., Sunday afternoon at 5 p.m. Our next church is called Liberty City Church of Christ, where you can get the word, located at 10624 East Jefferson, Detroit, Michigan. And their number is 313-898-2016. And their services are held Wednesday night Bible class at 7 o'clock p.m., Sunday Bible class at 9:45 a.m., and also on Sundays at 11 o'clock. And also, if you did not get the number to Linwood Church of Christ, their number again is 313-868-7795. Then we have Standard Rehabilitation Incorporated, where they treat fractures, auto injuries, back pains, and work-related injuries. They provide free transportation. Again, they provide free transportation. They accept all HMOs, Medicare, Blue Cross, PPOM, and so on. If you have any questions or concerns, please contact Dr. Bello Monday through Friday from 8:30 till 5 o'clock p.m. Located at 15785 Livernois in Detroit, Michigan. You can call them at 313-934-2623. Again, you can call them at 313-934-2623. 2623. The doctor name again is Dr. Bello, and they also have free transportation.
That's right.
And we're gonna move on. Our next one is the Veteran Hospital for Dr. Morrell, located at 15018 Illinois in Detroit, Michigan, zip code 48238. Their number, this is for cats and dogs, and their number is 313-863-5350. Open 7 days a week, Monday through Friday from 8 o'clock a.m. to 5 o'clock p.m. Saturdays, 8 o'clock a.m. to 4 o'clock p.m. Sundays from 8 o'clock a.m. to 2 o'clock on Sundays. So please get your pets there. Get them done and treated. And I encourage you to do both with them and Dr. Bello for the Relevated Standard Rehab Treatment Center. Okay. And last but not least, we have Sister United, who sponsors this program. We are a family of Center Ministry. If you have any questions, feel free to contact us at 313-615-6323. Again, 313-615-6323. Or you may contact us off of the website, sisterunitedoutreach.org. Again, sisterunitedoutreach.org. I encourage you all, please, if you enjoy the show, you love the conversations that we have on a daily basis every week, I will ask you to donate through PayPal. Donate through Sister United Outreach. Again, please, I encourage you to donate through Sister United Outreach. And we also have Let's Talk Family on the internet at www.bgntvgospel.com. Again, on Saturdays at 6 o'clock, live on your internet, www.bgntvgospel.com. And also we have Comcast on Fridays on Channel 20 at 11 o'clock a.m. You can turn on your television on Comcast and look at us in the morning while you're doing dishes or cleaning at 11 o'clock a.m. And let's get to Ann here, and let's get the show started. And I would like to thank you.
Oh, welcome. Thank you so much, Ms. Tina.
You're welcome.
Yes.
At Standard Rehabilitation Incorporated, located at 15785 Illinois in Detroit, we can take care of your rehabilitation needs. Dr. Bellows and his staff of healthcare professionals have extensive experience in rehabilitation and pain management. Our services include treatment for fractures, auto injuries, chronic and acute pain, work and stress-related injuries, just to list a few. Transportation is available. Dr. Bellows is standing by to service you at Standard Rehabilitation Incorporated.
So today we have Bob Sisler,
Hello.
and he's going to be talking about the single payer plan.
Yes.
So, first of all, what is the single payer plan? Many people out there want to know.
Yes.
What is the single payer plan? How is that going to benefit us if we did have that?
Okay. Let me explain what the single payer plan is.
Okay.
It is a publicly funded but privately run healthcare system that can exist in the United States.
Mm-hmm.
Now, before I start, let me tell you that there are 3 videos that are out that I would suggest that people look at, and you can get a clear idea of how our healthcare system has grown in this country, which makes it different from any other healthcare system in the world. One is Sicko by Michael Moore. The second is called the Healthcare Movie. That's done by 2 people. One, it's a husband and wife, and I don't know their name off the top of my head, but you can look it up. It's called the Healthcare Movie. She is Canadian, he's an American, and they've experienced both systems and they explored both systems. So that video is just about the comparison between U.S. and Canada. The third one just came out. It's called The Bitter Pill. This one is done by a doctor, a brain surgeon out of Flint. Excellent documentary on, again, how this healthcare system that we have in this country exists. Now, to begin with, we in this country feel very comfortable when you say, oh, I got my Blue Cross Blue Shield card. Now, why is that? Because we've been propagandized to believe if I have a Blue Cross Blue Shield card, I have health care. That is no longer true. What has happened is if you have a Blue Cross Blue Shield card, you may be paying more and more and more, both for the co-pays, deductibles, and even for the price of the insurance. It's just all going up. Now, why is that? Why is that? It's very clear from SICO. What happened with SICO is there's a section in there where they take the tapes from President Nixon, you know, the ones that got him in trouble with Watergate. The same tapes and video. They show him talking to Ehrlichman, who was his counsel at the time. And prior to the 70s, we had a system of healthcare that was nonprofit. That's why we had like St. Joe's. That's why we have Harper Grace. That's why we had Sinai. These were all not-for-profit institution, whether it came out of a Jewish religion, Catholic religion, Christian. You go down south, what do you see? The Methodist hospitals, the Baptist hospitals, and they've been changed to become for-profit hospitals. But when they first began, it was not-for-profit. It was a service that was given to people. And in our country, what happened there, and you'll see it from the video if you listen very closely in SICO, President Nixon is given the opportunity to enter this law. This law changed healthcare in this United States from a not-for-profit system to a for-profit system. And when it was first brought to him, President Nixon says to Ehrlichman, I don't think I like this program at all. Ehrlichman comes back and says, are you aware that Kaiser, and this is out of California, Kaiser Permanente is still the insurance company. Kaiser has found a way to make profit from healthcare, says this very clearly, by denying care. Now, can I say that again? He has found a way to make profit from healthcare by denying care. And it's after that point that we begin to have crises in healthcare system. Because by law, these systems could be set up, they weren't regulated, that they weren't for profit, and they would harm people because you're not going to give the care, you're going to hold it back. So what we have become is not we don't have a healthcare system, but we have an emergency system. So that when you finally get sick and you can't take it anymore, you get to the doctor, by that time you're so sick you need extra amount of care. Let me give you an example. I mean this is tons of examples, but this one was most recent. I have a cousin who's in her 50s. She has insurance. Her insurance she went to see the doctor. The doctor said to her a few months back, somewhere in February, you need to go see the specialist. So she calls about the specialist, and the specialist was $60. So people say, oh, why didn't she just go? Well, you know what she did, like most of us. What happened? Oh, a higher gas bill came in, had to take that $60 and take care of that. This came in, that had to go take care of that. So she didn't get to the $60. 4 months later, she has a massive heart attack, has to have a triple bypass, which cost hundreds of thousands of dollars. Got this? Had she been able to go, if we had a nonprofit system, and had she been able to go last February, the doctor even said, we would have been able to control this and you wouldn't have had to have this major operation. From a personal point of view, and I didn't realize it at the time, but myself, what happened was I had a deviated septum, because when I worked in the hospital I was hit in the face. And the septum came down and I couldn't breathe properly.
So why don't you explain to the audience out there, you lay people, what are you talking about?
Deviated septum is in the nose, and what happens is this cartilage will drop and block the nose passage so you can't breathe properly. So I go to the doctor, this is the doctor, and the doctor says, I'm going to cut this is what the operation's going to be, but I anticipate it's going to drop again in a year or so. I said, well, why don't you just take the whole thing out? He says the insurance company will not allow us to do it. I didn't realize what was going on at the time. So I had to have it done twice, the same operation. Now what's the problem with having the operation done twice? Twice, I had to go under anesthetics. Twice, there's more complications from anesthetics than anything else. Twice, that insurance company put me at risk of death. So, you know, because they have these rules and regulations, what happened to the doctor? I asked the doctor, I says, you're in there, I won't tell anyone, just cut it all off. I mean, that's all you have to do is cut it off. Well, who would ever tell? I wasn't going to tell. But anyway, they did, okay? So this is the problem with the for-profit system, all right? Now, when we start talking about single payer, everyone says, oh, it's socialist, it's this, it's that.
But let me ask you a question now, the single pay plan. Okay, now you have, it's private. Now what would prevent these other people from coming in and,
It's privately run, but publicly funded.
okay.
You got that?
Mhm.
So what would happen is, for example, DMC was getting money from the city and the state
Mhm.
to service people. This is exactly what would happen. Everyone would be serviced, but it would there'd be a price for the service. Let me explain. If we had had a single payer system when they started Social Security, do you know how much money is as a surplus in Social Security last week? As a surplus. You know, all this talk that we're going into debt and all this. When they did the numbers, we have $2.8 trillion in surplus in
Wow.
Social Security. Why? Because it's a single payment system that gives a insurance to people when they're disabled, and it also regulates for you when you get older.
Like
So-
Medicare?
Pardon me, yes, like Medicare. So the single payer system is often said that it is Medicare for all. So that the day you're born to the day you die, you would have it. What you would do with this system is when you're working, and this is why it's so important right now when we talk about jobs, when we talk about the present Affordable Health Care Act, there's all kinds of regulations. If you make so much, you have to pay this. If an employer hires more than 10 people, or whatever the numbers are, there's restrictions. If you don't hire so many, then you don't have to have health care for them. Then they have to have their own, and it's going to be based on income. This is simple. You know what happens? Just like you pay your FICA, just like you pay your Social Security, you would pay it every hour that you work. So the employer it's really good for the employer. You know why? Because it's simple. They don't have to go out and look for health care for you. Why? It's already there. It's already going to be there. A certain amount will be taken out for them. It ends up being cheaper in the long run. And I guarantee you, if we go into this system, we will have trillions of dollars after, I would say, 20 years after we do the service.
Okay. Now, you know, I know Canada has a health care for all the citizens. So is there a correlation between the single pay plan and Canada's plan? What's
The only
difference between Canada's plan and this plan?
Number one, in Canada, they do not cover dental or eye care.
Okay.
Canada does cover basic health care for people. What this plan would do is not only cover health care, but I mean, you know, your basic health care, but it would also cover your dental and your eye care. Now, will it buy you the most fanciest glasses? No. But it's going to make sure that you're basic. There's a bill out there which John Conyers sponsored. It's called HR 676, and it is the only single-payer plan that makes it illegal for insurance companies to sell you insurance that is, which would be basic for your health care. Got that? So insurance companies will still find a way to make money. They're going to want to give you a special room, or they're going to want to give you the better glasses or gold teeth. You know, this would be basic teeth that you'd have cared for. But guess what? You wouldn't have to worry if you have an abscess. People wouldn't have to walk around here worried about how to get a tooth pulled. You know, those things would be done.
So this healthcare that you're talking about, is in existing now?
No, not in this country. It's not existing.
Is they working on it?
We are working on it, but people don't understand it, so they're not telling their representative they need it. In the city of Detroit, we have Mr. Peters, Gary Peters, who wants to run for our senator, but he says his constituency don't know about it, and he wants you to call him. He says if you understand it and you want to have a change, then you have to give me a call, but if you don't call him, he doesn't know about it. I mean, he doesn't think that there's enough support for it.
So
Because many people don't know about it.
Then they have to learn.
Is he a senator now, or is he?
He's a
running?
representative, and he's going to run to take Carl Levin's place. I can give you his number if you want to call him. It might be a good idea. If you believe that we should have Medicare for all, that health care is a human right, and that we should not have any barriers to get health care, I recommend that you call him.
Well,
His number is 313-964-9960. Again, 313-964-9960. Have him, your grandma, your grandfather.
Carl Levin?
No, this
No,
is
not Carl.
Gary Peters.
Oh.
He'll be taking Carl Levin's place, or he plans to.
So now, audience, what we want you to know, if you think this is something that would be beneficial to your family members, the ones who don't have medical insurance, there's a lot of people who don't have medical insurance. We have people who do work, but then they still don't have medical coverage. So if you think this is a good idea, a single pay plan that where everyone will be covered, then you can call the upcoming representative Gary Peters. The telephone number again is 313-964-9960. Now, which you have young people who now they allow you to keep your young people on your insurance up to 25.
But what happens when you turn 27?
So we have a caller coming in. Welcome to the show, caller. What's your comments or questions?
You want information about the Obamacare? It comes into, some of the parts are already began, but it's going to come into into the full program 2014, so it's going to be next year. What has happened with the Obamacare plan was that states were supposed to set up a plan of their own in order to take this Medicare money. Now keep in mind, through the Affordable Health Care Act, which is the Obamacare Act, states would be paid for the first 2 years full program. After that, they would be expected to kick in something. Right now, you have Governor Snyder asking the Republican House and Senate to pass the bill. What has happened is that it went through the House, but it got stuck in the Senate. They do not want the people of Michigan to have this bill for some reason. What it would do is it would create all kinds of jobs across Michigan, number one, and it would provide for health care insurance for a lot of people.
Because a lot of people need it.
Depending on your income. Do you understand? It all depends on your income. The difference between our program and the Obamacare program is that we as the citizens would put into it while we work and take out of it when we can't work or we need health care. Now let me explain how this works. President Delano Roosevelt was a very wealthy man. I don't know if you ever met people who live on a trust fund, but if you meet people who live on the trust fund, they'll wake up in the morning and say, maybe I'd like to be an attorney today. Maybe I'd like to be a social worker. Maybe I'd like to do business. But guess what? They don't have to. Their cars are taken care of, their housing's taken care of, all because of trust funds that these families have set up over the years. What President Delano Roosevelt said was, why can't we have this for the working class? So that is what Social Security is. Remember? Every time you worked, you put in a few pennies, few dollars, few this, and now we've got trillions of dollars while we're still servicing people who are disabled, people who are elderly, people who really need help in our society. So it shows us that if we come together as Americans, if we use mutual aid to help each other, that we can create something as marvelous as Social Security. We can create something as marvelous as single-payer health care for all. So that when you go to the doctor, the first question they ask will not be, what is your insurance? But they'll be able to say, how are you? That is why this brain surgeon is so behind this. Maybe we can get him down here to talk. Why? Because every time, not every time, but a number of times when he's tried to provide health care for people, he's been blocked by insurance companies. He's been blocked by these administrators of the hospitals that have for-profit tried to even take him off of his privileges at one time. And let me tell you what, he gave a perfect example, and you working at the hospital may have this as an example. He was talking about how the nurses in the evening covered this ward, and there were 6 nurses assigned. Gradually what happened was this administrator began to have 5.5. Then he squeezed it down to 5. So that was a whole salary, a nurse's salary and benefits that they saved over the years. When he found out what they did with that money, he wouldn't have said anything if it went in to give people better care or write off people's bills or something like that. What happened was the administrator took it as a bonus. And because when you have a for-profit system, you can do that. When you have a regulated nonprofit, they're regulated, and it would be criminal to do that. Because what they will have to do is deny somebody care, even though the money's there, in order that the administrator gets a bonus.
But you said, let me go back.
Okay, let's see the caller. Caller, did you understand what he said?
Yes, I got the information, and that is the sheriff plan you referred to outside of Obamacare.
To what?
I'm sorry, you said what now?
What's the name of the insurance that you are trying to get your money here?
The insurance we're trying to get is and it's not insurance, it would be a single-payer health care. It would be Medicare. Medicare as we know it, but it would expand. See, Medicare right now pays 80% of a lot of things. This would expand to 100% of everything. It would expand to us buying medications in bulk, so that if you needed medicine, you'd go to the doctor and get it. You would not have to worry about having a copay or deductible. We could stop some of the corruption that's going on with healthcare.
Let's see.
Okay, did he answer your question?
Yes, that's right.
Thank you.
Okay, you talking about Medicare, that's for people that's like 65 and
Not really.
No, it is for 65. But what we're talking about is making it from the day you're born. So your children, you would have it automatic. See, there was some talk about having it come down to 55 at one point, that they take Medicare and bring it down to people who are 55. But you know why they didn't want to do that?
Why?
I'm sure there's 2 reasons. Number one, when they would bring it down to 55, you'd have a lot more healthier people, and that trust fund would have built faster with that.
Okay, I
don't. But not only that, now kids can get Medicare too. It depends on their disability.
Medicare, yeah, it all depends on the disability.
And Bob, would it affect the quality or not the quality of the doctor? The care of the doctor?
According to our doctor, it wouldn't. Because see, what it would do is free them up to be able to be a doctor versus a coordinator with the insurance company.
Okay. Okay, can I ask you a question? I know we have in our city,
Yes.
we have a lot of free clinics.
Yes.
I'm trying to
So
understand.
let me just address that. they say free clinic, but certain tests, you still have to pay. Certain tests you cannot have done.
I have went to Beaumont, and all my tests for everything I went for a year ago was free. It was nice.
So now if it depends on you talking about, there are some people, because I refer clients all the time. There are some, because see, some programs they have for women, it is free.
Yeah.
But when it comes to men, some of those programs are not free, even with healthy women. Certain tests they still have to pay. It says a free clinic, but sometimes you still have to pay a certain copay.
And, you know, I'm the way I met you was through Nurse Pat. And Nurse Pat had given me, she says, oh, we don't need national health care. She had given me 2 pages of free health care clinics. I had clients that were sick. I gave them, I had these things printed out. Here, if you need health care, go and get it. The guy came in, still sick, and he said, I called everyone, and I can't get in at least for 3 months. And I have this big growth, and it's paining me. I don't know what to do.
Okay, so.
I thought he was lying.
No.
I picked up that paper, and that was the truth. Some were over a year waiting list. And so we have a crisis in healthcare.
Yes.
We have people who are being hurt. Now, how does this affect the community? We were talking, I'm with the UAW, and we were interviewing some of the mayoral candidates. And one of the mayoral candidates is Benny Napoleon. So one of the questions we asked, here he is a police officer, we asked, what are your 5 objectives? What are the 5 things you'd like to see happen in the city? Number 1 was health care. That was so shocking to me because I thought he was going to say police force. He says health care, education, jobs, city services, and then he said policing, if we had these 4, would be an easy job. Because what he said is when you go into these homes, when they're visiting these homes, that's the number 1 cause that he sees of a disruption. People are not being adequately treated for their health care issues. It's prevalent. You see that both with mental health and with physical health. And when you're painting physically, your actions are not always appropriate.
Exactly. That's true.
In fact, psychiatrically, if you have enough pain, you can't give informed consent.
Well, you know, some of the mental hospital years ago, they closed them down, especially right over here on Lafayette in Detroit.
They closed them all.
them down.
And guess where people are at?
They were just walking around.
Most of them are in prison. And we have not treated them. And that was a
that's the panacea now. If there's a problem, then you incarcerate them.
Well, go back to what I said. We have a for-profit system versus a service of health care to our citizenry.
I just wanted to make sure the health care that you're discussing, that we're talking about, that we can call, and it's okay that we're under 65.
Oh no, what we're calling is Medicare for all. That's why it says for all.
From the time you're born until the time you
See, I think what you have to realize that Lyndon Baines Johnson, this is where history is so important. We saw what happened with Nixon with the for-profit. But prior to that, we had President Lyndon Baines Johnson who tried to get this health care program for everyone. That's what he tried for. He wanted Medicare for all back then. Even if it was 80 or whatever the percentage was. And he negotiated first for 100%. But you know, the story is, and I haven't been able to confirm this, but they were in Vietnam at the time, right? So he invited all these doctors to come because they were going to help out with the Vietnam vets, right? So while they're there on live TV, he says, not only are these veterans here to help us with our vets, but they're endorsing an exciting new health care program for seniors once they hit 65. And he tricked it so that once, what are they going to say? No, you got that wrong to the president? They said this is how clever Lyndon Baines Johnson was with the Senate and the House of Representatives. And he utilized, I mean, I guess he was really a genius. I was young at that time, but looking back at it, hearing people talk. But keep that in mind. President after president whether we talk about Bill Clinton, whether we talk about President Obama, know that single payer is the best way to go. The reason we don't have it is because we have a for-profit system, and the for-profit system have these lobbyists that then will put on TV, oh, we're going to be socialist.
And it caused people to be fearful.
Correct.
And so what they will do, they'll vote it down.
Well, that's
Or they
what
won't
that's what's
even
happening.
call, they won't even call their number,
So it's important that we understand what it is and then promote it. Now, let me tell you, to say this won't work is wrong. It will work, and it's been proven to work. There's a, people don't get very many raises nowadays, right? But a year ago, I believe it was, in February, we were coming back from Washington, and on NPR, there was an article or a broadcast that talked about a group of workers getting a 29% raise over 7 years. And they said, how could this happen in today's economy? How could these people get us that kind of raise? Well, guess what? Over 15, 20 years ago, they took all their workers, now it's the restaurant and hotel workers in Manhattan, but what they did was they took their workers and they put them in a single payer based system. They only used one hospital system. They only used one set of clinics because it was all single payer, right? So they got the clinics to agree that you would see the doctor, the patients up front, okay? And in the American perspective, this was there were special articles done on this. Why? Because it showed how it would work. If the doctor spent more time with you and you came in with a headache, what do they do now? Here's some pills, here's some pills. And you have to keep coming back with the headache before they find out you're having an aneurysm. And what usually what this showed, and they gave real live examples, that people who had the aneurysm were taken care of before it broke. And therefore, your time in the hospital may have been a day instead of 2 or 3 months. It showed that, just like with my cousin, if you got that health care, you did not have to go for the emergency. So why were they able to? They suspect that most people go up about 10% on their insurance every year. They anticipate theirs going up only 1% a year and may not even go up like that. No emergency room visits. Why? Because if you're sick, you go see the doctor.
Okay, now if
There's no blockage to you seeing the doctor.
Now, if someone wanted to go and do research on that, so where would they go?
You can look up Local 7.
Okay.
I wish I would have brought that one. With, I might have it on here. Local 7 restaurant and hotel workers out of Chicago, out of New York City.
Okay, that's what we want you to do. The things that we do say on the television, we want you to be able to look it up, this information. So look up, tell them again, look up Local 7, restaurant, hotel workers.
Hotel workers.
Okay? So look it up, and then if you have any question, you can always call the show. He's always on the air with us. And even no matter what we're talking about, you can say, well, I heard the show and you said this about the Local 7 restaurant hotel workers. I want him to explain something else since I've been on the...
And then what you do is counter-reference it with an article that they have in the American Perspective. That's a healthcare magazine. And they showed how this system could work and how it reduces healthcare costs.
Okay, Bob, I got something I would like to ask you.
Go ahead.
And you were saying Blue Cross is steady going up. Also, DMC healthcare system has went up as well. And
No.
Yes, it has. Yes, it has. I've been at that company for 10 years, and I have a friend that works there, and
I
they
believe
just
you.
told me about it. And also, that urgent care, it used to be $50 or $25, it's $100 now. Your ER emergency is $100 copay.
Well, since I work with seniors, let me tell you this story. If you are admitted to the ER, most insurance policies have it that you're covered, right? So we've had seniors who go into the emergency room. They're kept in observation for 3 or 4 days. They're not admitted, so that they will have to pay that $100 copay.
And not only that.
Now, what sense does that make when we talk about hospital care? If you're going to keep somebody in a hospital for 3 or 4 days, what either the doctors are stupid because they need to observe you for that many days, or the insurance companies aren't allowing them to take you in.
And what happened is, especially when I tried to discharge a patient to a nursing home, because caregivers are overstressed. But the problem with that is they have to be in the hospital for 3 days. 3 days, when I said 3 nights, before the nursing home will accept that patient. If, even for rehab, I tried to get a patient into rehab the other day. Patient needed rehab, but because the patient had Medicare, Blue Cross, and one thing about Blue Cross is supposed to be a non-profit organization.
Not now. Not now. Governor Snyder and the Michigan legislation has approved it to be for-profit.
Okay, well, it was almost.
So it's coming.
for-profit
It's coming.
anyway. But so the problem that we're encountering is this, that if you have a family member who has Alzheimer's disease, you can no longer provide care. You need to place them to a nursing home facility. Now, Medicaid, that's not a problem. But the nursing home would not accept that patient unless there's a 3-night stay in the hospital.
And that's all because of insurance regulations, not because what the doctor's ordering. That's what single payer does. Single payer turns around and puts the doctors back in charge of health care. Now, are you ready for another shock?
Yeah.
Okay, this is an article that was written July and August 2011 by Dollars and Cents.
Okay.
What it says is that the only solution to the healthcare system is a universal healthcare plan. Okay, that's what single payer is. And it says that single payer is the only one that can solve Americans' problems. Now, what it goes along in here, and keep in mind, this is 2011. I didn't think it would happen this quick. But what it says is that the healthcare costs avoid a fiscal and economic catastrophe. So what's going to happen is, and it's happening right now, the cost of healthcare is going from the employer to the employee.
That's true.
So to buy the policy, it's shifting right now. What also is happening is, in order for you to go to the doctor, the copay and deductibles are higher and higher.
Exactly.
Can
What-
I ask you a question? Are you saying that the employers are no longer paying any percentage of it?
No, it's just that the costs are going up so high
Okay.
that the employers are shifting more and more to the employee.
Employees, okay.
Or the kind of service you get is the employer can give you some kind of insurance, but your copay to see the doctor is $100 every time you go.
Okay.
You see what I'm saying? So the policies are switching to promote profit.
Now, what about Medicaid? Does this just get rid of Medicaid?
No, but what does? What?
If we get the single pay?
If we get single payer, there is no
There'll be no
Medicaid.
Medicaid.
No Medicaid.
Okay.
Well,
No Medicaid.
They're trying to get rid of that anyway. They've been doing that.
Yeah, but they're getting rid of it with no replacement.
Right.
See,
Exactly.
if we have single payer, then all the working people begin to make a trust fund that can only be used for health care. That's why under the Bush administration, they wanted to get into Social Security and put it into the stock market, because they knew that we, the common workers, had put all this money in, and it just irritates them that the workers could have a trust fund. They wanted to get at it, because they'd rather see us struggle instead of have something
So
that's
you
good.
got the have and the have-nots.
That's it, but wait, I want to explain to you what's going to happen. As these costs shift, okay, Americans will not be able to afford it. The prediction is that they will go bankrupt. And when they go bankrupt, they're going to go to the government and ask for a bailout. Now, somebody said to me, well, insurance companies, we don't bail out insurance companies. Well, we don't bail out auto companies either, do we? And guess what? If you go back in history, I'm going to tell you, not only what happened in 2008, also happened in 1993 with the savings and loan. It was the same template, and the Bush family was involved. Look it up, it's on the internet.
Yeah.
The savings and loan. So what's going to happen is these insurance companies are going to go bankrupt. They already have more lobbyists there than any other group. They will lobby these senators and will say, oh, we can't let people not get health insurance. That's the word they're going to use, not health care. Health insurance. So they'll want us to bail them out. Now keep in mind, we bailed out who? We bailed out the banks with our money.
That's right.
Only to have them do what? Foreclose on all kinds of Americans. After we bailed them out with our tax dollars, there should have been some kind of system put in place that if we bailed the banks out, they needed to keep people in their homes.
That's right.
They needed to do that, but they did not do that. In fact, through a lot of predatory lending, they threw people out. Now, let's go to the next point. There was a time when Lords of London, an insurance company, needed to be bailed out. There was some catastrophes in the world. So does it happen? Yes. Will it happen? I believe it will. The predictions, at least going along so far, is right on time. This is the article. It's Dollars and Cents, one of the more conservative papers. It appears 2011, and it says again, universal health care. Can we afford anything less? Why only single-payer system can solve America's healthcare mess. That's what they call it, a mess.
So if you're interested in this, we want you to call Gary Peters in Congress. Well, 313-964-9960. Again, that number is 313-964-9960. And then let them know that you want health care for everyone. And so.
And the other person, again, this is in the Detroit area, but I don't know how far does this go? Does it go to, whoever your congressperson is, call. If it's, who's the lady out this way? I'm trying to think. She used to be our Secretary of State. No, not Terry Lynn.
Right.
The one before her.
Right. Congress Warren?
I really can't think of her name.
Candace Miller.
Candace Miller, that's it. Candace Miller. Give Candace Miller a call. I don't have her number. The other person, if you really want to call, is Conyers, and his is 313-961-5670. Now, he's the one who introduced the bill, but if you thank him for it, he'll keep doing it.
Okay.
313-961-5670.
Okay, so these are some of the numbers if you want to change, you want everyone to have health care, call these numbers, 313-964-9960, or you can call Congressman Conyers at 313-961-5670.
And if you'd like to see the movie, I'm not certain if we can have Dr. Vivek come, but the doctor, the brain surgeon who did the documentary, we will be showing it at 11:30 on July 8th at 11:30 at the Vote Center, UAW Region 1A. That is on Livernois. It's 15140 Livernois, just south of the John Lodge. Phone number there is 313-864-7878. Again, that date is July 8th at 11:30. We will have a lunch served. Also,
that's good.
we have just found out that we're going to get a movie theater in Canton, where we will be showing it at 6:30 on August 12th. Now, the exact location, I'm not certain of yet, but we will be showing it there.
So we'll keep you abreast on these dates. So.
And then there'll be actions that people can take by calling their Congress people. And we, through the Retirees for Single Payer, will always come out and do a presentation to a church group, whatever, about health care.
Okay. Now, briefly, we're going to talk about canceling the Detroit debt to the bank. So canceling Detroit debt to the bank, why don't you give us a brief synopsis of that, sister?
Well, there's a movement going on, and it's been filed, that the banks were the ones that created the problem in Detroit. Now, what do they mean by that? What happened was when the banks got bailed out in 2008, and everyone now is saying 180,000 people left the city of Detroit. That's not true. 180,000 people were thrown out of their homes due to predatory lending that has already been adjudicated on, definitely proven. Banks are paying billions of dollars in fees, but guess what? The damage is done. People are thrown out of their homes.
So these 180,000 people that were thrown out of their home, so you saying they really didn't leave Detroit? What they did, where did they go? Did they go into apartments?
Some of them got homeless, some of them are, well, they're out of Detroit. But see, what happens when you have a home foreclosure? You're not getting any tax. And the banks weren't, you know, if they were going to foreclose on their homes, they should have been held responsible. Somebody should have went in there and passed a city ordinance that they keep those tax up to date. Or they should have been sued.
Well,
But that didn't happen.
But I noticed a lot of people now from the suburbs are moving back to the city of Detroit. And I'm looking at the picture.
Yep.
I've noticed a lot of that's been happening as well. So the houses in the city are cheaper opposed to in the suburbs. I
Yeah.
noticed that.
But some of the houses are gone. I don't know how many houses on our block and in our neighborhood that were really victimized by this predatory lending. That people just couldn't keep them up. Then what happens, they're thrown out. Everyone knows that they're thrown out. Why? Because they bring the dumpsters and they bring the police force to throw them out of the home. Then pretty soon it's empty. You try to watch it, but scalpers get in there and they rip it off and tear it up, and then pretty soon it's a shell.
Well, they have a lot of squatters now.
At least the squatter kept the house
that's what
up.
I'm saying.
I'd
That's
say
what
let
I
them
can't
squat.
understand. You know, if they have, throwing the people out.
Say, let them in and squat.
Yeah.
And someone else can come in and purchase their home for less money.
$1.
But then they won't sell it to the one that's been making payments all these years. I think that's unfair.
There are homes
is.
that I know of that the people had like a 30,000 mortgage, and it was this predatory lending where the arm went up so high that they couldn't afford the monthly payments. And then what happened was they ended up selling it to somebody for $5,000.
Or less.
And instead of letting the owner, if they've been making regular payments, it's like, okay, everything is under the water. So instead of me just letting the house go, we'll allow you to pay that price. But then
I'm going to tell you, when they had the conference at 600 on foreclosures, we heard stories where the banks told them that they were working with them, gave them a price, and they paid that price, and one day they came home and their houses were foreclosed on. Everything was just thrown in the dumpster. So what the banks were saying and what they were doing were two different things. They did not work with the people who bailed them out. And it was our tax dollars that bailed them out. Another thing that we have to look at is really the city of Detroit is getting a bad shake. When they say that we don't contribute, the first thing you have to look at is the lottery money.
Yeah.
Do you know that over 40%, I think it's even higher than that, of the money on a lottery basis every day is given by the city of Detroit?
Yeah.
Do you realize, I mean, I don't know this number. And, it's obvious. You go into the liquor store down in the neighborhood, they have 2 lottery machines. Why?
That's right.
Because they're doing that kind of volume. You go over to Myers, 24-hour store, they have one for all those people in there. So you know that the volume has to be there for them to have 2 machines. They don't give you a machine.
But see, what I can't comprehend is this. They always talk about they're giving so much money to the school from the lottery. And then the schools still have problems.
Well, because what happened
figure
was
out.
they took the money, they diverted it to the public, to the general fund. And that became a huge, well, that's what's happening.
Well,
And you know,
how is that, how is that happening? The general fund for the city?
no, for the state,
For the state?
yeah.
So it get divided.
So it's not going to the schools at all then?
It doesn't go directly, it gets
They get
filtered down.
a percentage?
I mean,
or-
look at,
They don't
the
get
governor
what
ends up
they
with
say.
millions of dollars, and what does he want to do? He's going to nicely shake it out, but you have, what, you have people who are, schools that are going underwater. You have cities that are going underwater. And he doesn't give any breaks except to who he'd like to at any given time.
Okay, now we're almost out of time. So we want to know, we're going to go around the table and see if anybody have any closing remarks. So we're going to start with you, Sister. What's the closing remark? What you want to tell the people out there?
My closing remark has to be that we are in a situation now where jobs and health care should be number one on our list. And I ask you to please take the time, look at John Conyers' website, and explore two bills. One is 1,000, which would guarantee everybody a job, and the care, which makes health care a human right. And if you are on this show, you must believe in God. And if you do not believe that you need to take care of the sick, then I don't know why you're watching the show.
Amen.
Okay, Miss Laura down there.
I don't have any other questions or anything to say. I just,
Shocked?
yeah, I'm a little bit shocked by the whole thing, and I pray that the best comes out for us. Best thing happens.
Can I say one thing behind that? The first time that we heard about single payer, I couldn't believe it. I was shocked. That's why you have to keep coming back and learn about it.
Yeah.
Thank you.
Okay, Tina.
I didn't get a chance to come back, so I just wanted to say again, please send donations through PayPal. You donate through Sister United Outreach. Please, I encourage you to donate to us. And I just wanted to say it was a nice show, lovely show, and I would like to thank you for tuning in.
Yeah, we want you to call those numbers, and if you think that we say something that you don't comprehend, you can always call us at 313-615-6323. And we do encourage you, if you want health care for everyone, you can call Gary Peters at 313-964-9960 or Congressman Conyers at 313-961-5670. Because we are our brother's keeper. Just because I have the insurance,
Amen.
doesn't mean that I don't want my brother to have insurance or my sister to have insurance. So we want you to be thinking about other people, not only yourself. Maybe you have insurance out there, but there are other people who don't. And think about them, because one day you're going to stand before God and He's going to ask you about your brother, because you are your brother's keeper.
Amen.
So we want to thank you so much for tuning into our broadcast. We did have a guest over there. I didn't know if she want to say anything, but who is she, brother, Mr. Sisler?
It's Darlene Holly.
Darlene Harley. So we thank you so much for being in our audience today. We want to also thank our cameraman. He always does an excellent job. We want to thank him so much. But we want to thank you most of all for tuning into our broadcast. If you have any questions or comments, you can always call us at 313-615-6323.
Amen.
And guess what? We love you, and guess what, ladies and gentlemen?
Yes, we do.
There's nothing you can do about it.
Contact us at 313-615-6323 and send your donations to P.O. Box 40154, Redford Township, Michigan 48210. God loves you, and so do we.
But in the morning, it's a brand new day. Hey, and I'm glad.
What's going on, y'all? It's Mr. Bell. Some know me as Antone Choirboy Bell. Others know me as Elder Antone Bell. I am co-CEO of Bell Global Network, BGN TV 2090. And I want to invite you right now to get your own broadcast. Calling all ministries, all politicians, all business owners. Get your own broadcast right now, starting at $99. And if you have an idea for a TV show, we can bring your idea to reality. We have packages available that includes production and facilities. Also, we have advertising packages starting as little as $25. So don't hesitate. Give us a call at 313-355-7877. Once again, that's 313-355-7877 to make an appointment today.